Heart health awareness. The hidden dangers of common medications. As a heart surgeon with decades of experience, I've seen thousands of senior patients walk into my office worried about chest discomfort, breathlessness, or sudden fatigue. Often the cause isn't just diet or stress, it's a medication they've been taking for years, sometimes even prescribed to help another condition. What many seniors don't know is that some common pills, taken daily by millions over 60, can quietly damage the heart muscle, increase blood pressure, or trigger irregular rhythms. These pills don't always show side effects right away, but over time they can weaken your heart and shorten your life. In today's video, I'll reveal the 7 most dangerous pills that may be harming your heart health without you even realizing it. This is not about fear, it's about awareness. If you or someone you love is over 60 and taking medications for pain, sleep, blood sugar, or mood, you need to watch this till the very end. Pill number 1 is the most harmful and the most commonly used. I am not asking you to stop anything without medical guidance, but you deserve to know the truth. So let's begin with pill number 7. Pill number 7, non-steroidal anti-inflammatory drugs. NSAIDs. NSAIDs, often called NSAIDs, include medications like ibuprofen and naproxen. These are used for arthritis, joint pain, or back pain. Common issues among seniors. Many people over 60 use them daily without realizing how dangerous they can be to the heart. NSAIDs can raise your blood pressure and cause fluid retention, which puts extra strain on your heart. For someone with a weakened or aging heart, this additional pressure may be enough to trigger heart failure or irregular heartbeat. Over time, NSAIDs can damage blood vessels and reduce kidney function, further burdening your cardiovascular system. If you already have high blood pressure or take medications for your heart, these pills can quietly interfere with your treatment. You may not feel the effects right away, but your heart is under constant pressure. That's why I always tell my senior patients to be very careful with over-the-counter painkillers. There are safer options for pain relief that do not increase heart risk. Always talk to your doctor before continuing NSAIDs for more than a few days. Pain relief should not come at the cost of your heart health. Pill number 6. Certain diabetes medications. Thiazolidinedionins. If you are managing type 2 diabetes, there's a class of medications called thiazolidinedionins, including drugs like pioglitazone. These are designed to lower blood sugar, but they may quietly harm your heart. These pills can cause fluid buildup, swelling in the legs, and even lead to congestive heart failure, especially in seniors over 60. While the intention is to manage blood sugar, the hidden risk to your cardiovascular system is serious. Many seniors with diabetes are already at high risk of heart disease. When you add a drug that puts more pressure on the heart by causing the body to hold extra fluid, it becomes a dangerous mix. Even more troubling, these pills can mask early symptoms of heart failure, like tiredness or shortness of breath. Some doctors may still prescribe them because they work for blood sugar control, but if you have a history of heart disease or even mild swelling, this medication can silently accelerate damage. Always ask your doctor if a safer alternative is available. Your blood sugar matters, but not at the cost of weakening your heart. Pill number 5. Sleeping pills. Sedative hypnotics. Many seniors struggle with sleep and rely on sedative hypnotic medications like zolpidem or drugs, older like diazepam. These pills promise better sleep, but they often come with serious consequences for your heart. Sedatives slow down your entire nervous system, including your heart rate and blood pressure. While this may sound helpful, it actually lowers your body's ability to respond to stress or oxygen demands during sleep. Over time, these drugs can cause sleep apnea or worsen existing apnea, a condition where you stop breathing for short periods during the night. This puts extreme pressure on the heart and can lead to dangerous heart rhythm disturbances. Also, these medications can interfere with essential heart medications, such as beta blockers, making your treatment less effective. The risk of falls, confusion, and breathing problems further increases with age, especially for those taking other medications. Poor sleep must be addressed. But long-term dependence on sedatives can slowly harm your brain and heart. There are natural and safer ways to improve your sleep without this damage. Talk to your healthcare provider before continuing any sleeping pill regularly. Pill number 4. Tricyclic antidepressants. Tricyclic antidepressants are older medications prescribed for depression, anxiety, or chronic pain. Drugs like amitriptyline or nortriptyline were once commonly used, but they come with heart risks, especially for people over 60. These medications can cause a variety of cardiac issues, such as irregular heartbeat, blood pressure changes, and even a dangerous condition called heart block. Over time, they can interfere with the electrical signals that control your heartbeat. This makes them particularly dangerous for seniors who already have arrhythmias or a slow heart rate. These drugs also increase the risk of dizziness and falls, which can lead to injury and further complications. Even if the dose is small, taking them for long periods without monitoring can be harmful. There are newer antidepressants that are much safer for the heart and brain in older adults. Unfortunately, some doctors still prescribe these older medications out of habit or other concerns. If you are taking a tricyclic antidepressant and feel tired, dizzy, or have heart flutters, do not ignore it. Always ask your doctor if there's a safer alternative. Pill number 3. Decongestants. Pseudoephedrine and phenylephrine. Decongestants like pseudoephedrine and phenylephrine are found in many cold and allergy medications. Seniors often use them to relieve nasal congestion or sinus pressure, especially during seasonal changes. But these pills can be very dangerous for your heart. They work by narrowing blood vessels to reduce swelling in the nasal passages. However, they also narrow blood vessels throughout your body, including those that supply your heart. This raises your blood pressure and forces your heart to work harder. For seniors, this extra strain can be dangerous, especially if you already have high blood pressure or heart disease. These pills can also trigger irregular heartbeats or palpitations. You may feel jittery, anxious, or even dizzy after taking them. That's your heart telling you something is wrong. Many people assume these medications are safe because they're sold over the counter, but age changes how your body reacts. What once felt harmless in your 40s can now be a major heart risk. Always read labels carefully and talk to your doctor before using any decongestant. Pill number 2. Proton pump inhibitors, PPIs. Proton pump inhibitors, commonly known as PPIs, are medications like meprazole or pantoprazole, used to treat acid reflux and heartburn. Millions of seniors rely on these pills daily, believing they are completely safe. But recent studies have shown that long-term use can increase your risk of heart problems. PPIs reduce stomach acid, which is helpful for reflux, but that same acid is also essential for absorbing key nutrients like magnesium. Low magnesium levels can lead to irregular heartbeats, fatigue, and even muscle weakness. Over time, PPIs can also disrupt your gut bacteria and contribute to inflammation, which is directly linked to heart disease. If you are taking PPIs for more than a few weeks, and especially if you are over 60, it's time to reassess. These medications should only be used for short-term relief unless absolutely necessary. If you're experiencing persistent heartburn, work with your doctor to find the root cause rather than masking it. Long-term heart health must always come first. Pill number 1. Calcium channel blockers. Calcium channel blockers are medications often prescribed for high blood pressure, chest pain, or arrhythmias. But certain types, especially older ones like verapamil and diltiazem, can be dangerous for seniors. While these pills are effective at relaxing blood vessels, they can also slow down the heart too much for seniors whose heart function may already be reduced. This can lead to dangerously low heart rates, dizziness, and even fainting. Over time, they may cause swelling in the legs, shortness of breath, and heart rhythm changes. Some calcium channel blockers can also interfere with other medications seniors often take, increasing the risk of complications. The biggest issue is that many seniors are prescribed these without regular monitoring, and side effects may be blamed on age rather than the drug itself. If you are experiencing fatigue, swelling, or a slow pulse while on these medications, It could be a warning. Never stop heart medication without your doctor's supervision, but always ask if there's a newer, safer option for your condition. This pill is powerful, but it needs close oversight. Final thoughts. If you're over 60 and taking any of the pills we discussed today, I am not telling you to stop them on your own, but I am urging you to talk to your doctor. These pills were designed to help, but when taken long-term or without proper monitoring, they can slowly damage your heart. As a heart surgeon, I've seen too many seniors hospitalized not because of illness, but because of the side effects of their medications. The goal is not fear, it's prevention. With the right awareness and support, you can protect your heart, live longer, and feel better. And don't forget, tools like the Senior Health Tracker app can help you track your symptoms, remind you about medications, and keep your heart safer every day. Now is the time to take control of your health. Stay informed, stay alert, and never be afraid to ask questions about the pills you're taking. Your heart is too important to ignore. If you found this video helpful, please share it with your loved ones and subscribe for more life-saving advice tailored for seniors like you. Take care and stay heart strong.